Welcome to DBC Diaries episode 41. Today we're with returning patient Nancy. She's been coming to us for a while with her family. This trip though, she ended up coming solo, and unfortunately years ago she suffered a stroke. And we've helped a lot of people with stroke recovery. Our intrathecal treatment has been incredible for this. We go into the lower back so we can go into the spinal cord fluid, get the cells in there so they can travel up the spinal cord fluid to the cerebral spinal fluid, to the brain, and start repairing damage. Now, the sooner you get a treatment like this done after a stroke, the higher the chance of full recovery. The longer it's been, say multiple years, like in Nancy's case, it can be a bit more difficult. She's had some issues with aphasia and, just things happening memory-wise because of it, but the treatment has really been helping her, getting her better every time. So stay tuned, listen to her experience with that, and also learn how we've helped her out healing some of her different joints. She's done her IV treatment and even the facial treatment. It really helps with the skin tone, gets you looking younger, slowing down the aging process. So stay tuned, we'll get into it. I'm Josh, happy to help. DBC Diaries Day 1. So today Nancy arrives, we pick her up at the airport, drivers meet her right in front in the airport there and get her to their vehicle and drive her to her hotel so she can rest and relax.
Hi, I am Paul, one of the drivers at Dream Body Clinic, and today I will be taking Nancy to her medical appointment.
DBC Diaries Day 2. Today, Nancy is going to come in fasted because we're going to start with a blood draw. We're going to take that so we can get good analysis of her blood, know where she's at from last time with any markers. We check vitals, just a whole workup to make sure she's good. And then we started with her MRIs. So in this case, we are doing both her shoulders, and this will give us data on how she's been doing since last treatment, where she's at. And it's just for any joint treatment, we require the MRIs because we want to see exactly what's going on. We don't guess. We make sure that we've got all the data so you have things to compare to. And once that's done, each area takes about 40-45 minutes, and then done, our drivers will take her back to her hotel where she can rest and relax.
So today we're going to see Nancy in the consultation. We're going to check the MRIs and the blood work. And tomorrow we're going to do the IV treatment, intrathecal treatment, both shoulders treatment, and the facial.
DBC Diaries Day 3. So today is consultation day. We've got all the blood work results back and the MRI scans are done. So the doctor will go over all of that with Nancy, explain the blood work, line by line, what everything means, where she's at now versus before, and compare the MRIs from last time so she can see what improvement she's seen, how things are going, and really understand it. Our doctors go in depth so that you can know exactly what's going on. And then once that's done, we go up to the admin office where we take care of payment. And with that, just so people know, we take Visa, MasterCard, American Express, cash, cryptocurrencies. All of these are acceptable here, and it's very simple. It's just like paying for something in the United States. There's no real difference in that regard. So don't stress on it. It's super simple. And once that's done, we get you back to your hotel so you can rest and relax. DBC Diaries Day 4. So today's treatment day. Nancy's going to come in. She's ready to go. She knows what to expect. She's been here before. The intrathecal treatment, though intimidating sounding, is actually very simple and safe. Our anesthesiologist puts the needle into the lower back, and it really doesn't hurt. I've done it twice. Very simple. And that'll get the cells into the spinal cord fluid so they can get to the brain. Then the shoulder treatments are very straightforward and simple. Quick, easy injections. And then the IV. And with the IV, you sit there and relax on the recliner, as you'll see now while Nancy explains her past experiences and how she's doing now with treatment at Dream Body Clinic. Welcome to DBC Diaries, episode 41. I'm here with returning patient Nancy. How are you doing?
Fine, thank you.
Great. So normally you come down with, the whole family, with your son-in-law and your daughter. Yeah, but today you came down solo, and we just want to see how you're doing. It's been, about a year since you were here last?
No, about 6 months.
6 months, that's right. So 6 months ago, and you came down. Did you come with your daughter last time, right?
Yeah.
Yeah, that's right. And, this time we're going to be looking at doing your shoulders again. We're going to be doing the IV, the intrathecal. And you did these last time, and we just want to see how you're doing, where you're at, and yeah.
It's a lot better. I could tell by my movements.
Oh, okay.
I could tell that it was better. I could reach further.
Okay. That's excellent.
Yeah.
And how are you feeling in the, head, I guess? Like, we did the intrathecal, trying to help with memory, help with lowering inflammation with the IV.
Better.
Yeah.
I'm taking some speech therapy now.
Okay.
And so I understand the process.
Yeah.
So they said that they noticed it right away.
Yeah, that's what your son-in-law was telling me, Ryan, that said you definitely seem more on point, all of that.
Yeah.
And that's great. So what was the original issue then, going back? Then
A stroke.
It was, yeah. And that happened, how long ago did that happen?
About 3 years ago.
That's right, okay. And so with that, what kind of symptoms did you notice from it? Like, what changed?
At first I wasn't able to process everything.
Yeah. And now
But now I can.
Great. Well, that's great to hear. Glad it worked for you. We've usually, the studies have shown if you can do it within the first year of a stroke, the highest success rate. But we've had a lot of people that it's been years after and still seeing improvement. So it's always good to see. In fact, I just recently did a treatment on my heart to help prevent a stroke.
Yeah.
My mom had a stroke because of this genetic issue where the wall in her heart didn't fuse properly. And so it turns out I had the same issue. So about 3 weeks ago, they went in and fixed up my heart to prevent me from ever having a stroke.
Hopefully.
Yeah, that's right. That's the goal. So
Because people in my family haven't had strokes.
yeah.
So I think it was just a lot of pressure.
Yeah, so many different things can cause it. And at the end of the day, though, it's finding a way to take care of it, help get the brain back to where you want it and get you feeling good. So I'm glad you're feeling good.
Yes, I am.
Well, thanks for coming back. Thanks for sharing with people at home. And if you at home have any questions about our treatments with stem cell therapy, take a look at the website. It's www.dreambody.clinic. You can scroll down on the homepage. All the treatments are listed there. Click on them. They got info. They got studies. They got videos of past patients you can see. And if you want to call us for a free consultation at any time, you just call 888-704-3977. I'm Josh. Happy to help. DBC Diaries Day 5. So Nancy's done. She's gonna go home and start healing, getting better and better. Thank her so much for sharing her experience with everyone out there. We know there's a lot of people dealing with stroke recovery. It's never easy. This is a great way to deal with it. We've seen really great success, like in a case with Nancy. If you want to learn more about it, please go to our website, www.dreambody.clinic. Scroll down on the homepage, all the treatments are listed. You can see, click on whichever one you're interested in. It's got all the information, prices, info, it's all there. And you can also call us for a free consultation anytime at 888-704-3977. I'm Josh, happy to help.